Is there an atrial fibrillation cure? The scientific perspective. Created by Upolife. Experts estimate that by 2030, 12.1 million Americans will have atrial fibrillation, or AF for short. The risk of developing the condition increases with age. Some of the most impactful risk factors are obesity, hyperthyroidism, diabetes, and smoking. The problem is, if you don't manage AF, you put your heart at risk. People with AF have a 4 to 5-fold higher risk of ischemic stroke compared to healthy individuals. Here, you will learn exactly what you need to keep AF in check. 1. What is AF and how it affects the heart? This disease accounts for more than 30% of hospital admissions for cardiac rhythm complications. AF is a typical type of heart arrhythmia. That means the heart is beating too fast, too slow, or very irregularly. This health complication occurs when both the lower and upper chambers of the heart are beating out of sync. When people have AF, they can develop chest pain, extreme exhaustion, pounding, difficulty breathing, and dizziness. This chaotic rhythm hinders the heart's normal function. It can result in blood stacking inside the atria and create blood clots. Once these blood clots start to form, they can detach themselves from the heart and move all the way to the brain. The blockage could then cause a stroke. However, it is common for the condition to end up weakening the heart and causing heart failure. That's why it is critical to get the proper type of treatment and learn to control the condition. 2. Is there an AF cure? Although there are medications and electrical cardioversion to manage AF, you can't get an AF cure. These treatment approaches don't cure the condition. What they can do is curb symptoms for a long time. According to 2019 reports, treatment strategies for AF include risk factor management, stroke prevention, catheter ablation, heart rhythm, and rate control. Patients who take adequate treatment decrease the mortality and morbidity associated with this disease. Each approach has its own use and impact. 3. AF treatment. Since there isn't an AF cure, you must consult with your healthcare provider on the best medicines you can take or the procedures you can use. A general practitioner can treat mild cases of AF. However, you might be referred to a cardiologist for more serious issues. This is a heart specialist that can suggest the ideal form of treatment. However, the treatment you'll get will depend on what's causing your AF. If it is the result of hyperthyroidism, then you will get medicine. Your doctor can suggest antithyroid drugs. Sometimes, surgery might be necessary. If there is no definite cause, you can get catheter ablation, pacemaker utilization, electric shock treatment, and medicines to manage AF like beta blocker. At other times, AF could be caused by exposure to stimulants. For example, too much alcohol, tobacco, caffeine, and medications. In fact, several drugs have been associated with AF. That's why it is crucial to let your doctor know about everything you are currently taking. That way, you can ensure you are getting the best possible treatment. 4. Can you stop an episode? Even though you can't get an AF cure, it doesn't mean you should let the irregular heart rate get out of hand. Whenever you feel like your chest is racing or your heart is pounding, then it might mean you are having an episode. If you have AF, see your doctor first to avoid any serious complications. According to experts, whenever you are having an episode, you should call a doctor. The chest pain and weakness could be a sign of a more serious health issue. You can also give yourself some of the necessary support. For example, you can try slow and focused breathing. This is a great way to stabilize some of involuntary fluctuations and relax the system. Another option is yoga, which can calm the heart and could decrease the frequency of AF episodes. Regular exercise can also be a viable strategy. Physical activity relaxes the body and engages a huge portion of its key muscles. Final thoughts. If you want to keep the condition in check, you should contact your doctor and ask about the best treatment approach you could go for. It is necessary to curb the symptoms and give people a comfortable way of life. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting upolife.com.